If you're a physical therapist interested in working with more cash pay patients and you're wondering, what are special tests that I need to be doing in a cash pay setting? How does that differ? Is there a different approach that I should be doing to my clinical testing? Is it a different order? What should I be doing, or what should I adjust to work with more cash pay patients? And I'm here to answer that. My name is Garcia, and I help cash pay physical therapists just like yourself thrive in business, improve clinical outcomes, and just become more successful. When we look at special tests, in an orthopedic traditional insurance-based setting, you're always trying to figure out where the root of the problem is, so then that you can work on the impairments based off of what's putting more pressure onto that affected tissue, and that helps the person enjoy life with less pain. That's 100% the objective with special tests. Now, when you look at a cash pay setting, the customer, that patient, is trying to look for an answer, or they're trying to find a solution to their problem. And the problem might be, I can't raise my arm above my head to reach for a cabinet. The ultimate goal is that they want to be in the gym doing workouts or playing with their kids. The problem is not that they can't lift their arm. The problem is that they can't do the things that they want in their normal daily life, in their workouts, with fitness, whatever it may be. So you as a clinician have to understand everything should target what the outcome needs to be. What's the solution they're looking for? In insurance-based care, you are looking for, how do I reduce swelling, reduce pain, and improve impairments to 5 out of 5, or improve the quality so an insurance-based provider can pay for it. Now that the patient's paying for it, they want the solution to the outcome. When you do special tests, now the intent changes. You're still trying to figure out what tissue is involved, but now, what does that help you do to get them to the outcome or solution that they want? So if you're doing shoulder range of motion, or you're doing shoulder testing, you might be used to, you're gonna do 3, 4, 5 different special tests to figure out what's the one tissue. Is it the supraspinatus? Whatever it is, that is the thing that you're looking for, and you say, oh, that's perfect. Now I'm gonna improve your scapular range of motion to offset that, improve your strength, do those things to now decrease that pain so you can do these things. The difference is on this person is, now they're trying to go to a higher level. The impairments are important. The special test is important, but how does that affect your plan of care? And the best place to start is the quantity of special tests that you need to do. And this is where it comes down to, how efficient and confident are you as a provider? Whatever you are doing in PT school or insurance-based care, you have to simplify that, because you need more time with the customer, more time with the patient, so you can solve their problem. Most of the time you spent a majority of your objective testing on special tests, impairment-based tests, and your subjective, and a little bit of time for rehab exercises and a real quick plan of care, because that was already dictated by the insurance-based provider or the physician. Now you have to do all of that inside an hour. So the patient really wants, what's the solution, what's the plan of care, what's the roadmap to get to where they want. So now you're actually going to spend much less time on the objective testing, the movement testing, and all those things, and much less time on the rehab programs, and more time on explaining what this plan of care is going to move forward with. So if you're used to a lot of special tests, the great news, in cash pay setting, you only need to do 1 or 2 max. That is it. Do not do more. And if you apply that principle from insurance-based care, you're going to have a patient who is flared up, thinks that this is probably a waste of their time or waste of their money, because they could have got that same treatment in insurance-based care. You have to provide something different. And the way you do that is, don't do what you were doing in insurance-based care. So now if you're only doing 1 or 2 special tests, they have to be the 1 or 2 things that tell you exactly what you need. And this is where clinical reasoning comes along. And as they're explaining their subjective report to you, you're already processing, what's the one thing that I need to rule in or rule out? Those 2 things will help you figure out if this is the thing that needs to happen. And if you're not confident, don't over test. You're going to simplify it, do your 1 or 2, takes your best guess at the direction you need, set that plan of care, and reevaluate on the 2nd or 3rd visit. Why? That way you don't flare them up and they walk out happier and actually more pain-free after that first session. So don't over test, pick your 1 or 2, and that'll set you up for success, and they'll actually want to come back. And that's the thing that early young cash pay PTs struggle with is they try and apply that same thing that they've been taught for years, and that's not the right thing to do because the consumer, the patient, has a different thought process here. And if you apply that, you're going to be in trouble and you won't have patients on your schedule. And over testing is one of the biggest problems early in a cash pay setting that puts a business owner or a cash PT risk for failure, and I don't want that to happen to you. So how do you structure special tests? Make them simpler and smaller on the front end and spend more time on the plan of care, but that requires that you did a lot of preparation leading up to all the special tests so that you knew exactly what to test to help you rule in or rule out. That will set you up for success inside your cash PT practice.